Well, let's get more on the possibility of a second wave in the UK being closer than was first thought, possibly. The UK government says it's poised to put more countries on its quarantine list straight away. It comes as COVID-19 levels in Belgium, Luxembourg and Croatia are reportedly prompting concern. Well, joining me now is the Senior Clinical Lecturer at the University of Exeter, Dr Bharat Pankhania. Great to talk to you, Dr Pankhania. Are we in a second wave, or are we having a second wave? How would you define it?
I would like to refer to it as a continuation of the original wave. What happened is it was introduced in January in the United Kingdom, and then we had the lockdown. So with the lockdown, the case numbers go down. And then with the lifting, and I must add, the premature lifting of the lockdown, we get more cases. So it is a continuation, and what changes is the behaviors. So as you come out of your lockdown and the virus is still out in circulation, you generate more cases. And with travel abroad and people coming back from European countries and elsewhere, we have the potential for more cases.
So do you think it was a mistake for the government to relax the lockdown when they did?
Oh, absolutely. And I have said this several times, that the lifting of the lockdown is premature. And my reasons are as follows. We had a high level of background number of cases. It was down, but it wasn't down completely. And secondly, our test and trace system was not fully operational. And one more thing, 90% of our population were not infected. They had not encountered the virus. So we had all those things ready and waiting to happen. And then when you lift the lockdown, you can't go back to a lockdown. We get the rise in number of cases.
Do you think that as the numbers start to creep up again, the government is going to have to reimpose this lockdown?
I think the backbone and the energy and the stamina for another lockdown is not there. So what the government ought to be doing, and I hope they will do, is delegate authority to local regions and local areas to manage their outbreak as it happens. Therefore, I foresee local restrictions, maybe regional restrictions as we go through. And I'm more concerned about the autumn months, when our behaviors change again and we become more indoor bound and closer with the colder weather. So autumn time, I'm very concerned about it.
So this second wave, as some are referring to it, but you were saying it's simply a continuation of the first wave. This could be bad, but possibly not as bad as a whole other wave coming behind it in the autumn or the winter.
Yes, indeed. So what is in our favor at the moment coming in from Europe in the summer months is most of our behaviors and activities are outdoors. And with an outdoor, we have that margin of safety in that not many people will get infected. On the other hand, as you start to enter September, October period, when people change behaviors, and if you have a high level of background cases already in place, you could get a lot of cases.
I mean, is there any benefit to the fact that we have all been through it now? People have lost loved ones tragically. Others have had to change their lives really quite dramatically. That we know what to expect and we know how quickly to do it. That perhaps it might be a more efficient lockdown a second time around.
I hope so. And those are my thoughts and wishes too, in that we've had a dry run in January, February, March, April, so on. And come the autumn period, we will have better knowledge and better local responsiveness with extensive testing and immediate lockdown. I noticed Prime Minister Johnson bringing in strict quarantine rules. That is a step in the right direction too. We've got to tackle it from every possible angle and be prepared for the autumn months.
Do we have enough PPE in place now? Do we have enough medicines in place now? We clearly didn't at the beginning of the first wave.
I hope so. I hope so with respect to the PPE. And there should be no fudging of the PPE guidelines to fit in with the shortage. That was a wrong thing to do, to readjust the PPE guidelines. Now, with respect to the medicines, unfortunately, we've got no medicines that actually work. We've got good results on dexamethasone, which works in severely ill people, and the others are in the trial phase. So we've got no medicines. The only thing we can do is infection control and don't drop our guard.
What about the impact on the NHS? We know that a lot of healthcare workers were really badly affected and many lost their lives over the last few months. The staff that working within the NHS are also pretty exhausted, one would imagine. How will they cope with another peak?
I think information and communication are very important. NHS staff felt pressurized into working in the hospital setting without proper PPE, and that was the biggest stressor. It really wears you out when you're working in a busy place without proper adequate protection. I think hospital managers, hospital clinical directors, everyone should come clean and say, we are going to absolutely protect you. And that takes away a lot of the stress of then seeing the infectious patients.
However, we did see more people from the Black and Asian and ethnic minority communities affected. This must be an incredibly worrying time for them. There is research being carried out into why they were so disproportionately affected, but that's not going to give us any answers, is it, in the next few weeks?
No, but what we do know, we shouldn't ignore. So as we do know that there are Black, Asian, ethnic minority people who are disproportionately affected, as well as people living in poverty, we should do something about it. And the something that we should do about it is profile all these people and identify the at-risk people and then do something about it. In other words, move them out of frontline patient face-to-face meetings, or move them from meeting people in crowded places or driving that bus or that taxi, those sort of measures, because we have now identified you that you are at greater risk. Let us give you additional knowledge, education, and personal protection.
But the problem is, for social reasons, that may not be possible. Many people from those communities are also living in really pretty poor areas. Those who aren't in the health service may have jobs that require them to travel long distances on public transport because it's all they can afford. Is there any real way to protect that community?
Yeah, I so agree with you. This is so difficult because they are not able to sit at home and do their work and earn a living via Zoom and Skype meetings. And therefore, I feel this is a difficult time. But what we can do, we must do, which is at least empower them by the medium of education, how to look after themselves, how to have their personal infection control in place, so that even though they have to go to work and work in busy factories and crowded offices, they know what to do to not get infected. So we should do that launch now of educating these people to make sure that we can at least protect them by knowledge.
Indeed. Dr. Bharat Pankhania, great to talk to you. Thank you very much.
Thank you.